Welcome to OnCue Magazine. I'm Stacy Smith. Pittsburgh is known internationally as a center for transplantation, research, and other specialties. But did you know that people from all over the world who have lupus come to Pittsburgh for treatment? Well, tonight, OnCue's Michael Barkley introduces you to a Monroeville woman who has this mysterious disease, but who also is predicting that a cure will be found here in Pittsburgh at the Lupus Center of Excellence. It's tonight's cover story.
I had a test today.
You had a test today? What did you get on your test?
I don't know. I did good.
You did? You like something to drink?
Juliet Hale and her son Devin spend lots of time together. Precious time, they call it. Devin is no ordinary 14-year-old. He does most of the housework and helps care for his mother.
I cook dinner. She's sick. Wash dishes, do my laundry. Do certain things around the house.
Because 39-year-old Juliet Hale has lupus, and she is sick often.
This is dental paste. That's what I use for my ulcers. This is hydrochlorogel. That is for high blood pressure. Neurontin. That's for my lower back. I have some nerve damage there.
She takes out bottle after bottle from her plastic medicine bag to show us what she takes every single day of her life.
You take 35 pills a day?
Yes, I do. Yeah, just to manage. Just to manage my health. And that doesn't mean those 35 pills are going to stop a flare. By no means, that doesn't happen. I can still get sick. I've been in the emergency room many times.
This is Juliet as a senior at Gateway High School, a beautiful, popular student and equipment manager for the football team. Soon after graduation, Hale contracted a host of illnesses, and it wasn't until age 21 she was finally diagnosed with lupus.
Doctors didn't know what was going on, so I knew something was wrong, and I kept on looking for an answer, and then they told me I had lupus. The doctor explained it to me as there's a war going on in your body. He said your immune system is attacking your body, but I had no idea the extent of the disease and what it could do. Right now I have renal disease from it. I've had surgery on my eye, laser surgery on my eye from it. I've had, both of my knees are bad. I have avascular necrosis, which is bone death in the left knee. And in the right knee, I have torn cartilage, bone spurs, osteoarthritis in my left hip, and I have arthritis in my back.
She also has diabetes and other serious symptoms related to lupus, which experts describe as a mysterious, potentially deadly disease where a person's immune system goes haywire. Instead of protecting the body, the immune system attacks the body.
I have discoid lupus, and I've lost all my hair, and I have severe scarring, and I have hyperpigmentation, and I have loss of pigmentation. So I have some white blotching through my skin, and that's due to lupus. When I was diagnosed, it took 13 doctors before I was diagnosed with lupus. The symptoms I had at that time were ulcers in my mouth, unexplained fevers, joint pain, fatigue.
Juliet wanted to wear a wig for this television interview. She covers her face with special makeup, but she does want you to see what she really looks like, how lupus has taken its toll on her skin.
That's me. That's me. I put on makeup every now and then. It took a long time for me. When the scarring started, it didn't come all at once. It was pieces. And I had to go through that. I used to try to hide from people. And my mother, she's always been there for me. And she told me I was the same person, in which I was. I mean, I'm just in a different skin.
Hale says each day physically is different. There are good days and bad days for lupus patients.
You can have nerve damage, you can have seizures. You can have muscle pain, bone, everything. I mean, anything in your body from the top of your head to the bottom of your feet, nothing's safe.
Luckily for Juliet Hale, what's called the best place for lupus patients in the country is on the first floor of McGee Women's Hospital of UPMC in Oakland.
It's very complicated, and it's clearly a disease of the immune system.
Dr. Susan Manzi is co-director of this Lupus Center of Excellence. The first, most basic question about lupus is probably the most difficult to answer.
What is lupus?
Lupus, it's a very mysterious disease, and a lot of people don't understand it, but the best probably way to explain it is that it's an autoimmune disease, meaning immune system attacking self. And your immune system is really there to help you fight off infections and anything foreign that shouldn't be in your body. And in lupus, for reasons we don't completely understand, we know a lot of it's genetic, your immune system begins to attack self. And in lupus, it can attack any organ. It can attack your kidneys or your heart or the skin or your joints, and so the manifestations can be pretty extensive.
At the Lupus Center of Excellence, patients come to be treated by a host of specialists: rheumatology, cardiology, dermatology, the list goes on.
And so patients come for what we like to say one-stop shopping, if you will, to get all of the care that they need for their lupus in one place.
All the specialists are under one roof.
Exactly.
Not to mention extensive research goes on here.
Right, and what we thought was important is that patients like to have the opportunity to participate in research. They want to do that. They're very sophisticated these days. They want new treatment options. They want a lot of different opportunities in research.
Leading research scientists here hope to find the cause of lupus and, of course, a cure. Already, a new blood test discovered here looks promising in diagnosing lupus and predicting when patients could get sick. 1.5 million Americans have lupus, most common in African American, Asian, and Hispanic women. And it's very difficult to diagnose.
It's because everyone that walks in the door looks differently. So one person, it may cause only joint pain and fatigue. In another person, it could be kidney disease. Another person, it could be seizures or convulsions and central nervous system problems. And so it's tricky. And it also is tricky because the population that it targets tends to be young women. And this is a group that you normally wouldn't expect to be sick in any way. And so patients can go for a long time without diagnosis.
In the meantime, lupus patients from all over the world come here. It's a source of pride, says Dr. Manzi, and a driving force in finding a cure.
It's really unique in the world in many ways. And first, the concept of having all the different subspecialists on site is clearly unique. Now, it may not be, there are other diseases that have gone in that direction. So, for example, the treatment of patients with AIDS or diabetes. But for lupus, it's really a new concept. Secondly, to have this kind of a world-class patient care and the world-class research component together is unique. There are very good research centers across the country, but it's this combination of the patient care and research together which is really unique.
So I have to get up at 7 and pick you up at 12.
Yeah.
The center brings hope, confidence to people like Juliet Hale, who suffer from the unpredictable and debilitating lupus. She, too, predicts the cure will be found in Pittsburgh. Until then, she vows to fight on, to live, to spend these precious moments with her son Devin.
I always tell him, I've always told him since he was very small, that he's my best medicine I could possibly have. I think when you're in a hospital and you're going through different medications and feeling pain and things like that, you have to have something to look forward to come home to. So he's my strength when those things happen.
And Juliet Hale is one of hundreds of lupus patients participating in the all-important research for a cure at the Lupus Center of Excellence at McGee.